All right, everyone. Good morning once again. So, as I indicated earlier, on your screen, we have some terms, and basically the assignment or the the assignment would have been to get some definitions or descriptions of each of these terms. All right. So I just need to stop the share for 10 seconds and say something. Okay, so let's get straight into that. And what I'll do, I'm not gonna call on any particular person. What I'd like is for all of us to be adults here, as we all are, and contribute. So it should not be just one person giving a description of each of these terms, right? As well as if after one term has been described, we have any additional information, we can bring it to the front to our class. And it's for the benefit of everyone. Okay? So who wants to go first? Atherosclerosis. Let me hear you.
So I'll go first.
Mhm.
So arteriosclerosis is a condition where plaque made up of fats and other substance builds up inside the arteries, causing them to narrow and harden. This limits blood flow to the lead to serious cardiovascular problems such as heart attacks and strokes.
Okay, thank you. So in effect, and this is what it is, right? Um, Atherosclerosis, the narrowing of the inner diameter of the arteries because of the buildup of plaque. Now, here's a interesting thought. Anybody knows where we get this plaque from?
That's not from the fats and stuff that we get from foods, like
Exactly.
trans
Exactly.
fats and
Right. So yeah, remember you have good cholesterol and bad cholesterol, HDL and LDL, right? Whichever is which, you guys could do the research and figure it out. But yeah, so and this is a critical component when we're looking at heart disease and the development of angina pectoris, and that could potentially lead to a heart attack, right? So yes, the narrowing of the inner diameter of the artery because of the deposit of because of fatty deposits and those things, right? So that's atherosclerosis. Emergency. Who's next?
I can go next.
Sure.
An emergency is a serious, unexpected, and often dangerous situation requiring immediate attention and action. An emergency poses an immediate risk to health, life, property, or environment requiring immediate action.
Right. And that's the critical thing there. It's immediate. No, emergencies are sudden, they are unplanned. Okay? They are sudden, they are unplanned. Nobody comes to work expecting their office to burn down. Nobody comes to work expecting their coworker to get an asthma attack or a heart attack or a stroke. Nobody leaves home and en route to work expecting a 10-car smash up with multiple fatalities or life-threatening injuries. But these things happen. So as HSE professionals, as professionals in the industry, what we can do is plan for the emergency. So understand that. Right. Somebody else is coming in. Right. So as professionals, what we can do is plan what our response would be. Hence the reason when we're looking at occupational health and safety and we considering the component of emergency response, we plan for things such as medical emergencies, traumatic injuries. We plan for fire response, for earthquakes, for flooding. Okay, we plan how our response, and typically within that you would have emergency drills. You should have regular practice sessions, and practice makes perfect, as we say, right? As we hear people say. The intention is to get your wardens and your co-workers to understand what is required of them in the event of an emergency. What you don't want happening, and I just going off the terminologies here a little bit, right? But I think it's important for us to understand this. What we don't want happening is during an emergency, let's say there's a fire, and the emergency response plan requires the safety wardens to help all the workers to evacuate the facility and get to the muster point, as well as somebody supposed to do a sweep of the floor or the entire building to see if there's anybody left behind or if anybody is unaware of the emergency, and if there's a possibility of being able to manage the fire in its incipient stage using a fire extinguisher, as the case may be. These things would have been looked at, a plan developed, reviewed, and approved. Okay? As I said, just as I think it's Abigail, right? Would have been saying emergency, um, it happens, it's sudden, it's unplanned, and requires immediate attention. Planning for emergencies and for certain situations, what we consider to be credible situations, allows us to provide that immediate attention, to attempt to manage this emergency. And I'll give you an example of that. So I would have worked in Pointe-à-Pierre at barrier field trading for just over 5 years, right? And yes, as part of the HSC department, we develop emergency response plans for a number of situations. Okay. I don't want to get into the divers incident. I worked on that day. I came to work for 6 in the morning and I left at 1 a.m. the next morning with that whole divers incident. And I mean, it's tragic. It's sad. I was angry. Um, I would have signed off on there. I would have done the gas testing. I would have done the review of the documents, and I would have signed off on their permits for the land-based activities at their work area, their workshop. Colleagues went offshore and did the other work with respect to what happened offshore. So I'll just leave it at that. But within our emergency response plans, one of the scenarios we looked at, because of the location and the type of structures we have in place, would have been, and this is a real incident, the possibility of an attempted suicide. And of course, within that, everybody was familiarized with the guidelines. Never in my wildest dreams would I ever think we would encounter an actual situation where somebody wanted to jump off a tank. And it happened. This guy climbed the stairs straight to the top of the tank, started screaming, cursing, and our emergency response plan kicked in. The necessary response agencies were called in. We had a crisis, and we had basically a crisis mediator, and we were able, with our rescue team, these guys were able to scale the tank, come down, and restrain this guy, and we're able to successfully bring him down to the tank and take him for the necessary medical evaluations. This would not have happened properly if we did not plan. And again, understanding what an emergency is, looking at your activities, your work activities, your facility and your task-based risk assessments and these things allows you to generate proper plans for the various emergencies. Right? Next one, first aid. First aid is supposed to be easy. Who want to take first aid? Because we would have discussed first aid the last class, right? Where we actually had a class. So let me hear you. Who want to take a stab at it? What is first aid? Don't get this one wrong, you know.
Immediate temporary care given to a person who's injured or suddenly ill until professional medical help arrives.
Right, good. Brandon, you wanted to add something to it? Or don't tell me you're going to say the same thing.
It's not the same thing, but it's the same concept.
Let me hear you. Make your contribution.
So it was the immediate or temporary care given to a sick or injured person before professional
Okay,
medical treatment is available.
I lost you there a bit. I don't know if it's my reception, but
No, I think it's my end because I've been having this problem with this
not a
device for a
problem.
while. Right? So first aid, the
Say it
immediate
again.
and temporary care given to a sick person or injured person before professional medical treatment is available.
Good. So, and again, it goes back to, if you remember, what we were saying on the first day. First aid is immediate care and stabilization. Yeah, so it's care given to an ill or injured person until professional help arrives. So you're quite right. And I'll take that. I'll accept that. So one of the things I want to make clear though, becoming a first aider or a first aid provider does not allow you to diagnose any medical condition. So we're not going to look at somebody and because they have the tremors or the shakes, we're going to say they're suffering from Parkinson's. We're not going to look at someone and because they have memory lapses, we're going to say they're suffering from Alzheimer's. No, first aid, we're not about diagnosing. We're about treatment of signs and symptoms, assessment based. And the entire EMS system or pre-hospital care is based on that concept, right? We follow what we call an assessment-based care model, or if you remember, excuse me, and I will continue apologizing for that. The concept of find it and fix it. That's what we do. Okay. Injury. Who wanna describe what an injury is?
An injury is damage to the body's tissues caused by an external force, such as a fall, hit, or burn, that exceeds the body's physiological tolerance.
Right. And typically, it is usually some external force impacting on the body, right? And when we look at trauma, this is exactly what it is, right? Traumatic injuries, an external force impacting on the body, resulting in subsequent injuries. Things such as, examples, we have swelling, bruising, deformity, fractures. Those are examples, right? So yeah. Okay, anybody want to add anything to that, or everybody's comfortable with that?
So we're comfortable. Well, I am.
Okay, good. Right. So here's the next one. Medical emergencies. And this is where we have a slight difference between emergency and medical emergency. So let me hear you guys.
A medical emergency is a serious or life-threatening health situation which requires immediate medical attention, such as heart attacks, strokes,
Right.
or severe
Strokes.
pain.
Good. So it's some condition that is affecting the person's body that requires immediate attention by a medical professional, right? Good. And you give some examples here, and I'm pretty comfortable with that. Now, how does this differ from the regular definition or description of an emergency? In this situation, we're dealing with human beings, we're dealing with an individual, a person, as opposed to, so we're becoming specific here, as opposed to the regular, all-encompassing emergency description that would cover person, place, event, those things. With the medical emergency, we're dealing with a particular individual who has suffered a particular condition that requires immediate assistance from a trained person or a medical professional. Okay? Here's a question for you. Can first aiders attempt to stabilize a medical emergency? Yes or no? Anybody? I throw it out to everyone here.
Yes.
Yes. Example, an asthma attack, a stroke. Some of the scenarios we will be looking at in first aid. Okay? All right, next one. Airway. What is the airway?
So I'll go. It's a passage through which air enters and leaves the lungs, including the nose, mouth, throat, and windpipe. Maintaining a clear airway is crucial for breathing oxygen to supply the body.
Right. And you're correct, right? Now, a major thing that you added here that you said, and this is something that the your colleagues in the other class they left out. It's the passage where air not just enters but exits. So breathing is, if you look at breathing, it's two phases: inhalation, exhalation. Inhalation, air enters through the airway or this passageway that is supposed to be patent or clear, unobstructed, allows air to get into the lungs where you're going to have gas exchange taking place, and oxygen, well, basically gets into the red blood cell, carbon dioxide comes out, and this air is exhaled again through the same airway, same passageway out. So yes, it's the passage that allows air to enter and exit the lungs. Okay, right. And I think you would have mentioned some of the structures, right?
Yes, sir.
Good. So next one, what is a pulse? Anybody? You guys had half. You had half an hour. You should have gotten all of these done, right? What is a pulse?
The rhythmic beating felt in the arteries as the heart pumps blood throughout the body.
Good. So let's expand on this a bit. So you said the rhythmic beating of the say it
Beating
again.
felt in the arteries.
Rhythmic beating felt in the arteries, right? Why is it a rhythm? Anybody knows? This should be very simple, especially if you have been in healthcare or involved with something with healthcare. Anybody knows why it's a rhythmic beating?
So I did this topic last week in anatomy.
Right.
When I think, let me see if I can remember it properly. I think it's when the blood is ejected, that is one complete cycle, and then that's when you get one sound. And then when it
Right.
enters, there's a next thing. So you get is A systole and systole.
Right.
Or I'm going
So
too far?
for this class, that's way beyond what we need to
All
know.
right, okay.
But that's not what you're saying, right? So
Yeah.
so for this class, when we're looking at a pulse, what we need to understand, and it's at the very, very basic level, it's a lot lower than what you'd be doing for A&P, right? Um, so typically, when your heart contracts and ejects blood out into the aorta, and as this blood travels, you're going to get that force being exerted on the walls of the arteries, right? Now, typically, when we measure in blood pressure, this is what we measure. This for the force of this blood that this blood exerts on the wall of the artery, when you assess or when you check somebody's pulse, that's actually what you're feeling with each contraction of the heart. Okay. Now, why is it rhythmic? Because the heart relaxes and needs to fill with blood again. But what was expelled continues along its merry way. Then you're going to get another contraction. The blood comes out, it's ejected again at a higher force. So that's why we're able to measure someone's heart rate by feeling the amount of beats we feel at the pulse site. Okay, that's all there is. As the heart contracts and pushes blood out, that significant force of the blood flowing, that force that is exerted on the wall of the artery. Then as the heart relaxes, blood continues flowing, it contracts, another bunch is expelled or ejected, and so we go. And it continues repeating. And each beat you feel at the pulse site, excuse me, is one contraction or one heartbeat. Okay. For the purposes of our class, this is all we need to know. For your anatomy class, you're gonna go with looking at the systolic over diastolic blood pressure readings and management and measurement of blood pressure and all this and the actual force exerted on the wall of the artery. I don't know if you would probably be looking at the pulse pressure, which is the difference between the systolic reading and your diastolic reading and all those other stuff. I don't know, but that's for your whatever if that is included in the curriculum for anatomy. Okay, all right. So what I want to do, I just pause for about 5 minutes, right? And I'll ask you guys: does everybody here know how to check a pulse? Let me just stop the share for a sec. So we have 1, 2, 3, 4, 5, 6. We have 6 persons in class. Does everybody know how to check your pulse or where to find your pulse?
So I'm not sure how to check it, but I know that you could find it in your wrist or your neck.
Right. Anybody else? Good.
You could
And
also
you're not
find
checking it with your thumb, you're checking it with your index and another finger because your thumb, you can feel a pulse in your thumb.
Good. Okay. Miss Jordan, you were gonna say something?
your temple, and I think it's behind your knees.
Right.
You could
So,
your ankle.
right. So the main pulse sites for first day, well, we don't actually check a pulse in first aid anymore. Right. When you look at basic first aid or standard first aid, we we don't do that anymore. Advanced first aid, emergency medical responder, EMT, so forth. Yes, we do. But let's learn how to check a pulse, right? Guys, this thing is really bugging me. But anyway, the main pulse sites we look at, we have the neck called the carotid pulse because we have the carotid arteries there. We have at the wrist the radial pulse site because the radial artery is there. We have for children and infants between the elbow and the shoulder, in the middle there, between the bicep and tricep muscle, right inside the muscle there, there's a pulse site. It's called the brachial artery, right? We can do at the groin, the crease of the leg by the groin, the femoral pulse, because the femoral artery is there. And we can also look at And that's for the purpose of emergency care, right? We can look at, there's a pulse site behind the ankle, right? And of course on your, what we call your instep there. So we have the, behind the ankle thing is the posterior tibial, and the, on the instep there's the dorsalis pedal. But for emergency care, the main ones would be your neck, wrist, by the elbow there for the infant and child, and of course the femoral by the groin. Those are the main ones. What we're gonna do, we're gonna check two pulse sites today. Okay. What I want you to do for me, I want you to take whichever hand is free, right hand, left hand, it doesn't matter. But we're gonna use two fingers, and you're gonna put it on your neck. Right? You're gonna put it on your windpipe horizontally. Okay. And if you're using your right hand, you're gonna pull to the right side of your neck. If you're using your left hand, you're gonna pull to the left side of your neck. Now, on the side of your trachea, or commonly called your windpipe, you're gonna feel a little groove there, right? So you just pull very slowly with your fingertips, the side of the windpipe or the trachea. You're gonna feel a little groove, and gently press there. Don't stick your finger in harder, you're gonna injure yourself. Gently press in there. You're gonna feel a same beating. You're gonna feel a thud against your fingertips. It's gonna go boop, 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 boop. Depending on how fast or how slow your heart rate is. Some people might be going boop, 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 boop. Some people who are in the gym every day, very conscious about their diet and very lead a very healthy lifestyle. Boop, 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 boop. Right? So try it and tell me if you get it. I just need to know that you found it, and then we'll do something else, another exercise with it.
Yes, sir, I found it.
Good. Anybody else?
Yes,
So
sir.
I feel I did. I'm not finding it.
Hey, you like to work anymore? You feel I forget? You feel I forget? I get sick, but me I forget.
Yes, sir, I found it.
Right. I want to know. All right. Brandon, Miss Drew, Katiana, you got it?
Yes,
I feel
sir.
I should join him more, 'cause I ain't feeling it.
You ain't feeling it?
Yeah.
No.
But it's supposed to be there because you're talking.
Keyword suppose.
It's there. It's there. Probably does not. So the first thing is you need to just relax the fingers, right? And again, two fingers on the trachea or the windpipe, typically around the area where your voice box is, or slightly lower around there, and pull to the side. All right, just pull to the side, whichever arm you're using. So just as your windpipe starts to make that little round curvature, you'll feel the soft little groove there. Gently stick your finger in there, and you're gonna feel it beating.
So you're getting something.
You getting something?
Yeah,
Nice.
you're getting something.
All right, Miss Drew, you getting through? All right, well, I didn't hear from her. So anyway, so what are we gonna do? That's your carotid pulse. Let's do an easy one, another easy one. Let's give me 1 second. Right, yeah, so we're gonna do another easy one, right? So what we're gonna do is we're gonna check the radial pulse, or the pulse of the wrist. And typically what we do, we take two fingers of one hand, again, index and middle finger, and we're gonna trace the thumb of the other hand. So if you're using your index and middle finger of your right hand, you're gonna trace the thumb of your left hand, come down until you get to the wrist. And in line with the thumb, you should feel the same beat. Now, you know what the beat feels like because you got it at the carotid pulse side. So you're going to check it for the wrist. So Go ahead and try it. Trace the two fingers, trace the thumb down to the wrist. And when you get to the wrist, just relax the fingers and you should feel the same bup, bup, bup beating on your fingers. Now, for some people, it's very strong, it's very bounding. All right. For some people, it's guys, just give me 1 second. I need to go mute for about 2 seconds here. Yes, guys. So, anybody found it at the wrist?
Yes, sir.
All right, one person. Miss Jordan, Miss Medina, Brandon, Katiana, Miss
So
Drew.
I've seen mine,
No,
but it's
sir.
faint.
Say again, Miss Jordan.
I'm feeling mine, but it's very faint as opposed to when I felt it from on my neck.
Okay. All right, but you found it, right? So somebody
Yeah.
just try shifting around the fingers a bit to see if you get it a bit stronger. Miss Drew, you got through?
Sir, I'm not feeling it.
You're not feeling it? It take a
No.
sick leave or no, just try it again. Take two fingers, trace the thumb until you get to the wrist. Now, for some people, sometimes the blood vessel might be a little bit deeper into the skin or into the muscle tissue, and as a result of that, it might feel a little bit softer. Some people naturally have a very strong, very bounding pulse, so it's easy to get it. Others, it's a bit thin, it's a bit thready. We're all different. It just requires a little bit of effort once you have found it once, it becomes easy. Right? Tatiana, you got through? Brandon?
Yes, sir.
Yes, sir, I got you.
Nice. Okay. So try it again. So what I want to do, we're gonna do measurements now. Okay? And typically when we're measuring somebody's heart rate or the pulse, we have two options. We can do for an entire 60 seconds, or we can do for 50 seconds, 15 seconds, 1 5, and multiply by 4. This gives us the figure. So in healthcare across the board, when we talk about somebody's heart rate or their pulse, somebody's respiratory rate, okay, let me just catch this one. Right. When we give those figures, it is understood we are speaking about the figure over a 1 minute period. So if we check for 15 seconds, we need to multiply by 4. If we do it for 60 seconds, well, you already have the full minute there. Okay, so what I want you to do, find your pulse at the wrist again, and let me know when you've got it.
I have mine.
All right, everybody else?
Yes, sir.
Right. So what we're going to do, I'm going to tell it, when I say start, I want you to check how many beats you get at the pulse site, how many beats you feel. And when I tell you stop, you're going to take a note of that figure. And we're going to multiply that figure by 4. Okay? So if when you check, you get 15 beats in 15 seconds, you multiply by 4, that's 60 beats per minute. If you get 20, you multiply by 4, you get 80. If you get 40, you multiply by 4, you should be calling the ambulance or making an arrangement to go to the doctor. All right? So, ready? And start. Okay, we're coming down here. 13, 14. Stop. Right. So multiply your figures by 4 and give me the figures you get. You shouldn't have to get a
60 beats.
60. Good. Anybody else?
80.
80. Okay.
So 80.
80. Good.
I get 24.
Something wrong there. Who got 24?
Something wrong with me.
Oh no,
I got 44.
you got 44? Yeah. Miss Drew, are you a fitness fanatic? You laughing? No, but so Miss Medina, you need to recheck that, right? That's the figure after you multiply by 4. That's the baseline figure you got.
I get 6. I multiply by 4.
Nah, something wrong there. Yeah. You have to eat. The fact that you're conscious and you're talking, you will know that it's incorrect. So you probably need to recheck it. So let's go again, right? We're gonna try again. Everybody, switch hands. So we're gonna switch hands now, right? And we're gonna get ready. And we're gonna start. Let me just get it here. Ready? And start. Get ready. And stop.
80 again.
80. Good.
I got 72.
72, right?
I got 68 this time.
68.
Yeah.
Something went wrong. We probably missed that 2 beats or something. Anybody else?
So
Good.
76.
76. So not 24 again.
It was next hand. I use the next hand.
So one hand, one arm
got
got a
60.
delay out. You got 60, Miss Drew? Good. So now you understand, right? And those figures should allow you to start checking at your neck and at the crease in your groin there to check the femoral pulse. Okay? That's just a little exercise and you could practice with your families and stuff. Okay? So thank you guys for that. Right. What we're gonna do now, we're gonna get back to the description of terms. Right. So we look at pulse. Right. Injection. Who would like to describe what an injection is for me? Anybody?
An injection is the act of putting a liquid, especially a drug, medical or non-medical, into a person's body using a needle and a syringe.
Okay, so it's a needle with a syringe and a syringe, right? And yes, it's medication or what's the other one you said?
Sir, I said non-medical.
Okay. So for healthcare, typically we use injections as one route to get medication into the body. Outside of healthcare, we can have these drug addicts. They inject narcotics into the bodies to get high. We also have insects that can inject toxins into our skin, right? For example, when a bee stings you, when a wasp stings you, because their stingers are like very thin hypodermic needles, right? So yeah, the act of injecting something into our bodies using a needle and a syringe. Arteries. What are arteries? Anybody knows?
I'll answer this one.
Mm-hmm.
Arteries are blood vessels that carry oxygenated blood away from the heart to the body tissue.
So they carry blood away from the heart, right? Now remember, not all arteries carry oxygenated blood. We just have one example, one um, exception to this rule, right? We're looking at the arteries that leave the heart and carry deoxygenated blood to the lungs. But yes, in effect, arteries carry blood away from the heart. And usually with arteries, the walls need to be thicker to withstand the force, the strong force of the blood that is flowing in them when the heart contracts. With veins, because they bring blood back to the heart, the force of the blood flowing in them is typically a lot less, and veins would normally have one-way valves embedded in them to prevent a backflow of blood, right? So yes, arteries, the walls are thick, they carry blood away from the heart. Um, what is the body? Anybody knows? Can anyone describe it for me? The body, the human body.
So the body refers to a physical structure of a human being composing of all organs, tissue, and system that works together to sustain life.
Wow, I feel like we're looking at the same description here, boy. Yeah. I'll look an AI overview. The human body is exactly as you described it. But yeah, in fact, that is what it is, right? Okay. Guys, so I forgot to mention, right? I would really appreciate it if each of these descriptions, you guys could put it on the WhatsApp chat for the benefit of those who are not in class today. Even though we have the recording, having it on the chat, the WhatsApp group, means everyone gets access to the information immediately. Remember, I said at the start of the program itself, we're not going to hoard or hide information. We're going to share information with everyone, right? Next one, shock. What is shock?
So for this one, I got two definitions.
Right, let me hear you.
Okay, so the first one I have is a sudden upsetting or surprising event or experience. And then the second one I got is an acute medical condition associated with a fall in blood pressure and insufficient blood flow to the body's tissues caused by events such as a loss of blood, burns, allergic reaction, sudden emotional stress, and marked by cold, pallid skin, irregular breathing, rapid pulse, and dilated pupils.
Wow. Oh yeah. You got that from Wikipedia.
Yes, sir.
No, so which one you think sounds more appropriate?
I think the second one was the
Yeah, yeah.
life-threatening
So
medical.
yeah, so in effect, shock is a life-threatening condition because whatever, it doesn't matter what the cause is, it is a life-threatening condition because it results in in this concept or this term, inadequate tissue perfusion, right? So in a nutshell, your body requires oxygen and nutrients, and the main nutrient is glucose, right? Your brain could only function on oxygen and glucose. When somebody goes into shock, there is a decrease in the supply of oxygen and nutrients to the brain and vital organs. Whether it is the person gets some bad news and the blood vessels suddenly expand, they dilate, the person faints because there's a drop in the blood pressure, hence a drop in the amount of blood getting to the brain. So you have a drop in the supply of oxygen and glucose. Person faints. And normally the body, just like you would reset or reboot a PC or your laptop, if it's frozen, the body reboots itself right after a few minutes. Um, we have other types of shock, such as hypovolemic shock, where there's a blood loss. And loss of blood volume means the amount of blood available to carry oxygen and nutrients is diminished. So it's just like Citygate to San Fernando. During the day, you have 200 maxis. And now suddenly, because of an accident on the highway, there's traffic, and you only get 5 maxis getting back to City Gate to transport passengers. So the available maxis has dropped. All right. And when we lose blood volume, we lose red blood cells, which are responsible for transporting the oxygen and stuff, right? And excuse, yeah. So back to the concept of shock. It doesn't matter what the cause is, whether it's um, dilation of the artery, whether it's loss of blood volume, whether it is any other condition, right? The end result is a drop in the available supply of oxygen and nutrients to the brain and vital organs, and we term it inadequate tissue perfusion. Okay? External bleeding. What is external bleeding? Anybody want to tell me? This should be very easy.
Ex
Hi? Somebody?
External bleeding
Mm-hmm.
is blood loss from a wound on the outside of the body, such as a cut, scrape, or small puncture. It can often be seen or controlled by applying pressure.
Right. And the main thing here, remember, bleeding is twofold, internal and external. The difference here with external bleeding, there is a break in the continuity of the skin. And because of that, you can actually see blood loss. Whether it's a minor wound, a minor laceration where blood, you see blood seeping out, or blood flows out for just a small amount, or a major laceration where there's a major break in the skin, you see blood spurting or spraying or flowing, um, and seeing a lot of blood escaping. This is the difference here with external bleeding. There's a break in the continuity of the skin, so you can actually see blood leaving the body. Now, in both cases, internal and external, blood loss is of no benefit to the body because this blood is no longer within the circulatory system. So it's unable to transport oxygen and glucose. And hence the reason blood loss, depending on the volume lost, could result in the person going into shock. That's why you want to control bleeding as quickly and safely as possible. First responder. What is a first responder?
A first responder is the first trained person to arrive at a scene of an emergency to provide care and support until professional medical service arrive.
I like that description. So make sure you share that, eh? Make sure you share that. Thank you. I can't add anything to that. Right? I think oh boy. So I'll just digress a bit. Anybody here ever reach a point? Actually, I think I want to stop the recording for this. Right. Pressure points. What is the pressure point? Anybody? Somebody need to tell me what is the pressure point.
I have pressure points are areas on the body that when manipulated through massage, acupressure, or striking may cause a significant effect ranging from pain relief and relaxation to severe pain and disorientation.
Okay. So, right. But I'm sure you probably would have gotten about 4 to 5, maybe 6 different descriptions. For first aid, the one we want to use here, and I'll just read it to you. This one is from the Merriam-Webster dictionary, but in healthcare, we look at the pressure point as a point of the body where you're gonna have a blood vessel that's flowing close to the surface of the skin that can be very easily compressed against an underlying bone. So if you look at the radial pulse, right, the radial artery that flows pretty close to the surface of the skin. If you compress the radial artery, when you are feeling the pulse site, if you press it, if you squeeze onto it even more, you could actually cut off the blood flow to your fingers by compressing this vessel against the underlying bone in the wrist there. Okay, it's the same thing with the femoral artery. The same thing with the brachial artery as well. Okay, so for our medical terminology, we look at the pressure point as the point in the body where a blood vessel could be compressed against the underlying bone to either slow down or totally stop blood flow in an effort to control bleeding. Okay. Right. Emergency medical service. Anybody knows what that is?
Okay, I'll go. Emergency Medical Service, EMS, is a system that provides urgent medical care to transport to healthcare facilities in emergency.
Cool. If you didn't take that, I would have get vexed. But anyway, we will work with that. So those are the main ones, right? I just want to share. Let me just stop the share here on this one. I want to pull up a particular slide from a PowerPoint I use to give an additional description of some terms. Right. I'm just trying to get it back here. Just give me 1 second. Let me find it. Right. So I'll give you two things. Let me just right. So let me share it here now. So this is from our emergency medical responder program, but I think it's pertinent information for you guys. So typically we describe EMS and in its simplest terms. Yes, you're correct, Ms. Medina, but we're gonna add it, right? Or make it simpler if we can, if we go that route. EMS system is typically a chain of human resources and services linked together to provide continuous emergency care. Now, a very important part of this is the understanding that EMS systems manage situations outside of the hospital. Hence, the reason it's also called the pre-hospital system. Okay, we have no control of what goes on inside the hospital. That is the nurses, the doctors, and these various healthcare professionals, right? All the specialists, all the surgeons. But outside of the hospital, from when the patient's location and transport to the accident and emergency department or the emergency room or whatever you call it, that is pre-hospital care. This is where the EMS system comes in. And I want you guys to pay attention to this part here, right? Because it's important for us to understand a couple terminologies as well. The emergency medical technician. The EMT is considered the minimum level of education certification for ambulance personnel. So this training emphasizes assessment, care, and transportation of the ill or injured patient. Now, the EMT may also assist with the administration of certain common medications, right? Previously, years ago, it was called the EMT Basic. With our legislation here in Trinidad, the Ambulance Act, it is still called the EMT Basic, right? They have not amended the act to change it. We still have EMT Basic, EMT Intermediate, and EMT Paramedic. The world has done some changes to the titles, and they've called it the EMT, the advanced EMT, and the paramedic now. Okay, so somebody could just take a screenshot of this and you could put it on the chat as well, right? For everyone's attention. Right, good. So let me just stop the share with respect to that. So just share the, where is the document here now? Okay, so the descriptions would have covered for Unit 1 and completed Unit 1 in the first aid curriculum. We looked at the first responder, and I also gave you guys the description of the EMT, so that would have been part of Unit 2. Our lecture last class, well, the first class we had, would have looked at the roles and responsibilities of the first aider. So we would have basically completed a lot of Unit 2. Okay. What I want you to do for next class, actually next class we look at some of the medical emergencies and stuff to take care of Unit 3. I normally don't give homework, but because I missed 2 classes, I'm gonna have to give some homework. All right. So somebody needs to take a screenshot of Unit 4 here, right?
Sir,
Yeah.
I just wanted to let you know that sorry for entering and exiting the class. We're having some power outages
No
because of
need,
the storm just passed.
no problem. Are you okay, right?
Yes, sir.
Okay, good. No need to apologize. It happens. That's okay. All right. No need to apologize for that. That's a non-issue. Right? Excuse me. Unit 4, rule of voluntary organization. This is your homework for next class, everyone here. And also you could put it on the chat for every person in this group. I need to know what is the role of the Red Cross, St. John's Ambulance, any government organization that deals with emergency response and disaster response, right? And then we can look at any other organization, whether it's a private NGO, whether it's a private entity that does response during emergency situations, right? So with under other, you guys could choose one, just choose one, and give me a description. So we might end up with 6 persons doing 6 different organizations, right? As well as we might end up with 6 persons doing 3 organizations. That's okay. But I need for you guys to look at the rules of these various organizations, and all I need is a 1-pager or a 2-pager. If the information takes up 1 page or 2 pages, the standard letter size page, you don't need to write an essay. This is not one of those formal assignments. It's just for you to get the information. Okay? So take a screenshot, put it up on the chat, let everybody know this is their homework for the next class.
So I have a question.
Sure?
Regarding those of us that's outside of Trinidad.
You look at your look at your country.
Okay,
What are
nice.
the various various emergency response organizations and disaster response organizations? That's okay. And actually, I'm glad you would be providing information for me to learn as well. Okay?
Okay, sir.
Nice. Anybody else? Right, so I'll just stop the share here now. All right, guys. So let me just stop the recording.